My name is Dr. Kurt Belk, and I'm a board-certified emergency physician and the medical director of the Urgency Room. I want to thank you for choosing us as your healthcare provider. The following video offers follow-up care instructions to your recent visit. I'm Dr. Kurt Belk, a board-certified emergency physician. You're watching this video because you were diagnosed with a respiratory infection. There are many types of respiratory infections, and the definition spans a broad range of illnesses from mild to severe. Upper respiratory infections are those found above the vocal cords in areas such as the sinuses, nose, and throat, and can include the common cold, sinusitis, laryngitis, which is an infection of your vocal cords, tonsillitis, pharyngitis, an infection of your throat, or laryngotracheobronchitis, more commonly known as croup. Some types of influenza, otherwise known as the flu. If you've got an upper respiratory infection, you may be experiencing a runny nose, low-grade fever, cough, and nasal congestion. Lower respiratory infections tend to be more serious and involve the bronchi, trachea, and lungs. Illnesses include bronchitis, pneumonia, pertussis, known as whooping cough, and some strains of influenza. Some of these illnesses span both the upper and lower regions of the respiratory tract. Respiratory infections can be caused by both viruses and bacteria. Our recommendations for your treatment are based on your signs and symptoms. When you visited us, you received a physical exam and perhaps diagnostic tests such as lab work or x-rays. Medications are usually not prescribed for most upper respiratory infections because they are often viral, and antibiotics are not effective in fighting viruses. Antibiotics are used to treat bacterial infections. In some lower respiratory infections, where significant swelling is occurring, such as bronchitis or croup, your doctor may prescribe a steroid to reduce inflammation or an inhaler to help with your breathing. Once you're home, get plenty of rest, food, and water. If you or your child stop eating or drinking, develop a high fever, or appear extremely ill, come back in for medical care right away. The duration of your illness can vary greatly, anywhere from a few days to a week or even a month. We hope you feel better soon. This video is an overview of respiratory infections. Watch the video we've created about your particular illness for more detailed information. These videos are intended to provide helpful health information to the general public. They are not intended to be a substitute for professional medical advice. You should not use this information to diagnose or treat health problems, and you should not use these videos in place of a call or visit to a medical professional. Talk with your physician about the proper treatment for your particular condition, and always follow your physician's advice. If you think you need an ambulance or are experiencing a medical emergency, please dial 911 immediately.